next I'm going to discuss about the medial palpate technique for the knee joint. So starting position again it will remain same as we did for the anterior palpation. So patient should be in a high sitting position or the edge of the couch, and the trapeze position it should be in front of the uh, patient and little bit opposite side. So first of all, identification or the localization. So here we have two landmark, or we can start from two different locations. First is just medial to the apex of patella by identification of joint line, and second is here I have marked the location of the medial epicondyle of the femur. So let's start with the identification of uh, joint space. First, again, as we discussed in previous lecture, the joint space is formed by proximally because of the presence of femoral condyle, and distally it is because of the tibial plateau. So this line is representing the tibial plateau, and this proximal line is representing the location of femoral condyle. So we can follow this joint space and move in medial direction, and ultimately after reaching here this joint space is disappearing, oh, and the consistency is of mixed elastic type consistency I can feel. Why? Because this is the location from where the Sartorius muscle group basically which comes from here and insert over the anteromedial aspect of the tibia. So that's why after when you start training this joint space, as well as you will reach over the medial aspect of the knee joint, it will disappear, and because of the proximity of the tibial plateau and femoral condyle it is also disappear. So one method is to reaching over the medial aspect is to identification of this joint space. Another method is directly you just place your hand, flat grip, make a flat grip, place your hand over the medial side. You can keep the leg like this, means you can place the ankle or foot or the thigh, or you can take the help of a stool. Basically this facilitate to the rest of the posterior group muscle is basically hang down. So it helps in, it basically facilitate to clear identification of all the landmark, bony landmark which are found over the medial side. So just perform after identification of femoral condyle, perform a circular palpatory technique, and you will identify a bony, small bony protrusion over here, basically which is because of the presence of your femoral epicondyle. So it is here, it is already marked. Further, if you slide from here more proximally, this elevation become taper proximally. Means it basically it is taper like rough structure. It convert in a rough structure, which is the insertion point of your adductor magnus. So here again I have marked the location of adductor magnus. If you want to identify this muscle, just apply the pressure from the medial aspect of the knee and ask the subject to perform adduction. Do it? Yes. And again perform a perpendicular palpatory technique, and you can feel the contraction of the muscle. So this is the location of your adductor magnus, and this is alternative method. You can follow this muscle and ultimately you will reach over the adductor magnus tubercle. So means there are nothing to confuse. Basically these two bony landmarks, it is very proximal to each another, and you can say these landmark is almost the same landmark. First, you will identify the most prominent part, that is called the femoral epicondyle, and the rough area of this bony elevation is called the adductor tubercle, which provides the attachment to the adductor magnus muscle. From here, another structure we can identify, that is basically the location of your medial collateral ligament. Again, it is marked over here. So from here, vertically downward, just slide your finger pad and then perform a transverse palpate technique like this. Concentrate your force more over the anterior side of the tip of the finger. Apply a firm pressure and then perform it in anteroposterior direction and try to identify elastic band-like structure over here between these two lines or between the joint space. If you are still not able to identify, you can apply the valgus stress like this, and then this ligament will get tight and you can identify it very easily. See the movement of the finger. This is sliding underneath my finger pad. So this is the location of your medial collateral ligament. This is very difficult to identify. Basically, it is the presumed anatomical location of your pes Anserinus muscle group attachment point. Basically, pes Anserinus muscle group is formed by four muscles, that is your Semitendinosus, Semitendinosus, Gracilis, and Sartorius. So it is a combined attachment which is found over here. But we can feel all these muscles or the just proximal to the knee joint line or the posteromedial aspect of the knee joint. Slide your finger pad more proximally. Again, lift the knee like this. Apply resistance just posterior to the ankle and ask the subject to perform knee flexion. Yes. Now you can observe, relax, do it again, relax, do it again. This muscle is contracting and relaxing. Do it. Now you just perform the palpate technique. I can feel a very strong tendon over here, which is basically related to the semitendinosus. Rest of all these three muscles will be discussed in posterior knee palpation technique. So it's all about the medial palpatory technique of the knee joint.